This is Jen Anikina on iSurgeontalks. I wanted to discuss cataract surgery and the lenses available for this. And this is a big topic. I mean, you can do hours and hours of discussion on this, but I'm going to do a succinct summary as I would do for patients who come to my clinic. So, if you've been diagnosed with cataract and you need cataract surgery, there are different options for the lenses available, which we use as implants in the eye to focus the light. And this actually also applies to what's called clear lens extraction or refractive lens exchange, because it's essentially the same operation as a cataract operation, but before you develop a significant cataract. So, when we take out the natural lens of the eye, be it a clear lens before the cataract develops, or if it has a cataract, we take out that cloudy lens and we put in a clear plastic lens to focus the light. And the technology for the clear plastic lenses has developed a lot in recent years. So the majority of patients will still receive, this is both in the national health system and in the private sector, the majority of patients will receive what's called a monofocal lens. And the monofocal lens gives you the best vision. I'm going to put that right out there to say that it gives you the clearest, sharpest focus and the best possible visual outcome, but it only gives you that focus at one distance. So when we put that lens in, we will have a discussion with you. Most patients will prefer to have distance vision with the lens. So that's what's called an emmetropic aim, aiming to see far away. And that means that you will need to wear glasses in order to be able to see near, so for reading and close work, and also likely some glasses for intermediate distances, such as using the computer. Otherwise, things will be out of focus and blurry. And these will be quite strong reading glasses, so you'll probably need to change the ones you have already if you have them. We also have the possibility of changing the focus of the lens that we put in and putting in a reading lens. And so some people prefer to have that, people who spend a lot of their time doing close work, for instance, sometimes elect to have reading vision, which essentially makes you slightly short-sighted. And what happens then is you need to wear glasses to be able to see in the distance and to drive, like if you were a low-level short sight. If you had low-level short sight. So that is the majority of patients, and that's the best option for a lot of people. And usually my screening question for patients is, do you mind wearing glasses? And a lot of patients don't mind wearing glasses if it's just for reading, or maybe they're short-sighted and worn them all their life. And so if wearing glasses is not a major problem for you, then this is probably the best surgical option. What other lenses exist? Well, there is a subset of lenses called the monofocal plus, which essentially has the same technology as the monofocal lens, gives you the sharp vision, but they have a sort of a special coating, a special surface on the lens, which tries to extend the visual range a little bit. And so some patients with those lenses manage to have a bit of intermediate vision without needing glasses. And especially if you set the eyes for slightly different focus. So one eye slightly more distance focus, the other eye slightly more reading focus, and that can give you a slightly more useful range of vision. So I do use these lenses as well. These tend to be often my standard ones instead of a standard monofocal, because I think it's a bit helpful to give it a chance to have that little bit extra. Beyond these lenses, there are something called EDOFs, extended depth of focus lenses. And what these do is they have different points of focus inside the lens. So the lens is manufactured in such a way that it's got different strength of focus throughout the lens material. And that usually will give you good distance vision, but also good intermediate vision. And some patients manage to get some reading vision out of it, perhaps with a weak pair of glasses. And again, with these lenses, we will sometimes offset them slightly, one a bit for distance, one a bit more for near, so you extend the kind of functional range of vision between the two eyes. These lenses do come at the expense of visual clarity. They do carry some glare and some halo effects, so these are typically noticeable around lights at night. So in particular, if you do a lot of nighttime driving, these kind of more premium lenses can be tolerated less well. Saying that, the glare and halo effects in modern lenses, they're not sort of huge. It's important to be aware of them. There are going to be some people that are really troubled by them, but a lot of people aren't going to be bothered too much. Because what you find is that cataracts often give you some glare and halos, and so if you've got a little bit of a reduction in those with surgery, but not a reduction all the way, it's still an overall improvement. The final type of lenses that exist are what's called the trifocal or the monofocal lenses. So the modern ones tend to have 3 focal points. So that will be your distance vision, your intermediate, and your near. So these lenses are designed specifically to get you out of wearing glasses completely. That's the aim of the technology. And the good patient to have this lens implant is somebody who absolutely hates glasses. So you may have gone all your life without wearing any, and suddenly you've got presbyopia, you've got age-related lens changes, you're needing your reading glasses, and you hate it. That's the perfect patient for this technology of lens. Saying that, we need to do quite careful patient selection, because the lenses will not be correct for everyone. Because if you have other eye problems, if you have problems with your eye surface, astigmatism can be an issue. There's lots of considerations to be borne in mind. But ultimately, these lenses have a good effect. So 80 to 90% of people easily get out of glasses wear completely with these lenses, with clear vision at all distances. Perhaps if you're doing lots of very close work, you might need a pair of readers, but most people manage without. But these lenses do come with the glare and halo effects as well, which are a bit more significant than those for the EDOF lenses. Still, a lot of people don't mind it, don't notice those effects too much, but this is a discussion which is important to have in terms of the expectations from surgery. And approximately 5% of people, after having this sort of lens implant, are not happy with it and need it removing and replacing, or something else doing, so they can't tolerate the effect. It's important to also bear in mind, which I think we need to carefully discuss with patients, the fact that with the trifocal lenses and the EDOFs, there is what is called the neuroadaptability that needs to happen. Your brain needs to learn to use the lens, because the lens has different focal points at different points inside the lens material. You need to learn to use your retina and your brain to look through different parts of the lens in order to see at different distances. And this takes time. This is not going to be kind of an instant natural fix. And some people get on really well with it, and within a few days are sort of pretty functional. But other people take several months to get used to the vision and to be able to use the new vision in a good, useful way. And typically, that neuroadaptation will take probably on average about 3 months in order to get that optimum vision. But in some patients, it will take longer. And all of this is important to bear in mind if you're considering this technology.